What happens though when we look at this, right? So, childhood brain injury and mental health. What does the research show? Well, higher likelihood of current depressive symptoms if they had a prior concussion or brain injury, anxiety, difficulty making friends, use of medications for mental, social, behavioral issues, and mental health therapy counseling. So these are the people who turn to alcohol, marijuana, other drugs of abuse. They may be loners, right? They're more likely to end up in mental health places as we're going to keep going through this. So they have a higher rate of mental and social disturbances. Nearly one quarter of children with significant symptoms after head trauma are never checked for a concussion or brain injury. And so imagine you have a teenager, or maybe it's yourself and you're in your 30s and you have depression or anxiety and you've had concussions. Guess what? That may be a contributing factor. And if you don't do this right, you get the wrong treatment. When you do the wrong treatment, you get the wrong outcome. TBI and depression. 29.3% of women and 21.9% of men develop depression after a traumatic brain injury. With, once again, remember, concussions are the most common type of traumatic brain injury. History of concussion, 3.3-fold greater risk for depression of diagnosis in adolescents. Experiencing concussion or mild TBI was associated with a 2x higher risk of suicide. So, and then, as they said, higher risk of suicide attempt and suicide ideation. So it's not just thinking about it, but it's actually going through and trying to make it happen. So depression, anxiety, suicide.